Hi, and welcome to Why Do We Do That, a psychology podcast that deconstructs human behavior from the perspectives of social scientists, psychologists, and others that use applied psychology in their work. I'm your host, Dr. Ryan Moyer. In this episode, I sat down with clinical psychologist and researcher Dr. Or Dagan. Or earned his PhD in clinical psychology from the New School for Social Research in New York City. He has conducted research at the Developmental Stress and Prevention Lab at Stony Brook University and at the Center for Attachment Research in New York City. Or currently serves as a professor of clinical psychology at Long Island University, while also maintaining his private practice. Or and I discuss the topic of attachment, which deals with the bonds children establish with their primary caregivers, and how these relationships influence one's development and personal relationships throughout life. Or makes a very convincing case for the explanatory power of attachment, especially how it relates to the development of early coping mechanisms. One of the big takeaways I had from our discussion was the importance of balance in the parent-child relationship. While not being present to serve as an emotional anchor for your child can lead to some negative outcomes, not allowing them off their metaphorical leash to explore the world independently can also have some equally problematic effects. I also enjoyed how clearly Orr articulated the emotional needs of young children. It's all too common for parents to attempt to modify their children's emotional expressions out of their own desire for convenience or peace. While setting behavioral boundaries is still an important part of parenting, knowing when to remove judgment and criticism, and letting children experience their emotions while using you as a reliable base seems to be the skill set that will foster development the most. If you've ever spent time wondering about the patterns that you exhibit in your relationships, perhaps a constant fear of abandonment or feelings of discomfort when you get too close to someone, then I hope this episode gives you some perspective and insight. Enjoy. Okay, today I am here with Or Dagan. Thank you so much for being on the show today.
Thank you for inviting me, Ryan. I'm happy to be here.
So Orr researches an area in psychology known as attachment, kind of falls under the umbrella of developmental psychology. Why don't you just start by telling the listeners what attachment is?
Yeah, it's oftentimes mistaken for a lot of things. So how about we start with what I believe it really is? Really, it's attachment represents a specific type of relationship between two people, and it really reflects a relatively small aspect of human life. That is, when we are under distress. And so we might have multiple relationships in our life, many relationships perhaps, but only a few of them might be thought of as attachment relationship. And those attachment relationships are normally formed earlier on in life. We might talk about this a little bit later, but we really are thinking about figures who can provide us care, specifically emotional care, at times of need, when we cue for distress, when we feel sick, when we need emotional support. Those who consistently or inconsistently we learn to be there for us at times of need are thought of as attachment figures.
And now, does attachment relate to both these very early stages in life where, I'm picturing crying infant and the mother is attending to that infant and soothing the infant? And does it also extend into the younger, the ages 1, 2, and 3, where the child is given some space to play? What are the critical ages for this attachment process?
Yeah, Bowlby, the father of attachment research, spoke about attachment as something that we have from the cradle to the grave. So we are born with this natural tendency, really evolution selected for it, mainly because we need to help survive earlier on in life. To your question, attachment relationships or attachment behavior, something that reflects us as infants going to figures or needing figures at times of need, is something that we really think about forming as early as 1 year or a little bit prior to one or the first year of life. And this really sets the stage for our understanding of who really is there for us at times of need earlier on. There are multiple ways of assessing attachment throughout the lifespan, but it's clear that all of us develop attachment, or most of us develop attachment to at least one figure, and that kind of influences the way or the pattern that will later on in life attach to other figures. If earlier on in life we're talking about a mother, a father, or other close others, sometimes grandmother, or even an older sibling, later in life it's often cased we're talking about peers or romantic relationships. It's yet to be all that clear whether earlier attachment is associated directly with the way we attach to others, and there are multiple ways of thinking why we're still not sure to understand that empirically, but conceptually there are definitely attachment behaviors that can be observed way after the first year of life and really throughout the lifespan.
Now, what exactly is the child looking for when they're in this emotional state, and then they're seeking these figures of attachment? In other words, is the parent just being there enough? Does that explain most of the benefit, just having the parent present, or is it the case that being present is inadequate and the parent has to sort of, provide warmth and if the child's upset, they have to soothe, and they have to provide emotional attention and care, or is it just the case that being present gives you most of the benefits?
It is a great question. I can tell you from my clinical experience that a lot of times when I start inquiring to something that comes across as attachment-related experiences, oftentimes patients would tell me, I don't think I have any problems in my past. I certainly don't think attachment applies, because I know that every time I cried, I remember that mom used to be there. Why am I raising this right now? Because you're asking about presence. Is presence enough? Or when a patient says, mom is there, is that enough for us? That's where we stop the line of evaluation. The answer is no. What we are looking for very early on and really throughout the lifespan is proximity. So another way of thinking about attachment or attachment behaviors are proximity-seeking behaviors. Earlier on, as you were saying, we are crying as a way of cueing to mom or dad, hey, we need you close by. Later on, as adolescents or adults, we text someone that we want to attend to us at times of need. Now, if we think about babies or children, we can also think about a mom, for example, who is at home, especially in the past years where some parents were at home during the pandemic. Presence was not really the problem. But the level of quality of responding to the child's needs, that can vary significantly between caregivers. So, for example, a baby can cry, or a child can ask mommy, and mommy is in the next room, and child know that mommy is in the next room, but mommy also does not come out, or mommy yells, not now, I can't do that. Now, of course, this happens from time to time, but when it starts to be consistent, there is some aspect in the child understanding that starts to develop and consolidate around the idea that mom is probably not going to attend to my needs, even though she might be there physically. Now, earlier on, these needs especially revolve around I should call them instrumental needs, like feeding. When we are in pain, we want to reduce the pain, but there are definitely emotional needs as well, such as being soothed and feeling less anxiety when the world sometimes can feel like that.
Yeah, it feels it feels familiar, this idea. If anyone has been around young children, there is this very strong desire to feel needs met, right? Like, because most children, they don't, a lot of their needs they can't physically do, so it kind of makes sense that they're demanding this sort of attention from their parent, right?
Absolutely. And remember, this is something that evolution selected for. Think about a baby that does not cue, hey, I am in need. It takes a lot of time for human babies to actually be able to take care of themselves. So this is something that is ingrained in our DNA, so to speak. So yes, we need this to survive, but later on in life, it might be less of a survival, life or death type of thing, and more about getting proximity because we need emotional support.
Yeah. And now, is it the case that, because the more I think about this, the more I think about the transition from needing parent to take care of basic needs to independence. Clearly there has to be some sort of transition. I'm curious, from an attachment perspective, how does a parent build and go from I will be there and give you what you need to these are the things now that you can do on your own?
Well, I think this is a great question, especially because there's not much attention when we talk about in everyday life about attachment, when we talk about exploration or independence. We really talk about, I want to be close to someone who can take care of me, but really the two are intertwined. When we do have someone who we feel secure around, or who's functioning as our safe haven, to whom we can go to at times of need, it is exactly that secure base that can allow us to go out and explore the world. And to your question, be independent. So the two are really closely related to one another. It is when we don't trust one or multiple caregivers that we might also have troubles developing independence, because we don't have enough attentional resources to go out and explore physical or mental environment. We really try to stick as close as possible to those who can help us at times of need. And if we don't trust that they can do that, we're really kind of hijacked by this anxiety of what's going to happen if something bad will happen to me? Who's going to be there next to me? So the independence is really important aspect of secure attachment. Having said that, I also want to mention that earlier on in life, it is very appropriate not to develop much independence, although I understand that there is a lot of movement toward thinking about children needing to be independent. But really, independence, we really see that developing significantly around adolescence. That's where we actually wanting to develop relational independence, go out, explore relationship with peers and romantic relationships. And this is exactly where we also start seeing more psychological difficulties letting go of parents. So I hope this answers the question that you raised.
Yeah, and it reminds me of this idea that, and you kind of touched on it earlier, that as much as we value independence at those young ages, it can be a problem to be too independent, too exploratory. It's actually functional to rigidly follow what mom or dad says in very specific contexts, right? Like don't touch the outlet, right? The child that rigidly follows it without questioning right? They're going to avoid the electric shock and a potential, deadly encounter. The child that's rogue and independent at this young age, where you can kind of build a story like, oh, that's good for them. If they're going to doubt what mom and dad are saying and then go be curious, they're going to have a really bad outcome. And it kind of underscores this idea that independence needs to be mixed with sort of these boundaries, perhaps drawn by the parents, right?
That's right. And we can think about one category that researchers assess in terms of attachment is one category of insecure attachment is the avoidant insecure attachment. And these babies seem to direct their attention away from parents at times of need when they are distressed. So you might think about it as a very independent baby who doesn't need to show or feel like I don't need to show that I'm under distress when mom is leaving the room and I'm in this strange place by myself. But really what we know about those babies is that the cortisol levels, kind of the anxiety levels manifested in the physiological responses is sky high. And they develop an expectation that they're going to be alone in whatever difficulties they are facing. So we got to be careful when we think about independence, especially in young ages, where it might not be all that appropriate to develop.
Mm-hmm. Now, some of your work, I believe, kind of looked at homes with a single parent versus two parents. Obviously, that can kind of have, it seems to me that would have some interesting impacts on attachment, especially, if you have sort of one style of attachment or trust in one parent, but you don't have that trust in the other. Could you talk a little bit about that dynamic of a single parent versus dual parent home?
Yes. Again, if you're thinking about attachment from an evolutionary perspective, infants are born in communities. The fact that in some places in the world today, we don't have many caregivers does not reflect most of the history of humankind. And that raises the question of, okay, well, when we're talking about attachment, we're talking about a baby needing a figure at times of need. Who are we really talking about? Are we talking about a single caregiver, which I think for the most part, this is what people think about when we think about attachment. We think about normally, by and large, attachment to the mother. But this raises the question, is it really the case? Or do other figures are there for us that we develop attachment with? So the line of research that I'm right now leading is really a continuum of research that started some 30 years ago, but it's kind of the interest around it has been developed recently, which is, do babies and children with multiple secure attachments are better off across multiple developmental domains compared to those who might still live with two parents, but be securely attached to only one parent, meaning feel that they can go to that parent in times of need, but they don't feel like that with the other parent. And comparing those two groups to those children who have no secure attachment, not to the father and not to the mother. And by the way, I talk about fathers and mothers because this was our research design, but of course we know that there are also two-parent, so-called non-traditional families with two fathers, two mothers, and in some respects we have more than two caregivers, depending on the culture we're talking about. And interestingly, what we found is a couple of things. First, those who have too secure attachment, both to mother and to father, tend to have significantly lower depression and anxiety compared to those who have either one secure attachment or no secure attachment, right? So there is something to be said about how sad and anxious we are given how many secure attachment we develop earlier in life. In a recent research that is now in press, we also found that those who have too secure attachment, again, both to mother and to father, tend to have better language skills compared to those who have only one secure attachment and zero secure attachment. Now, one would say, okay, well, why do we care about that? Well, because number one, language skills are predictive of academic competence later on in life, and that could bring happiness for one. And number two, we also know that language skills are associated with depression and anxiety later on in life. We might not get into the mechanisms today, but this is the case. So really, both cognitively and emotionally, it's worthwhile for families to develop, or for babies to develop attachment security with two parents compared to only one or none of them.
So when children are building this secure attachment, they're experiencing distress. They have a caregiver, ideally a parent or an adult or someone like that in their immediate proximity. They approach the figure, and the figure sort of allows them to diffuse their emotional reaction to whatever the situation is they were in. Now, if that pattern, if they start to realize that they're not getting that, it seems to me that a child would get it somewhere. Like they would either turn to something like let's just say sports, for example. Like, I have an activity, and when I do this activity, like play football, it makes me feel secure, and anytime I'm stressed, I go to football. Or take an even more sort of out there example, like a TV show. Like, I feel uncomfortable in the social situation, I don't get anything from my parents, my TV show, I go watch the show, like a sort of psychological baba, Is it the case that we see children that don't have their parents providing them the soothing behavior or the attachment that they need? Do children go to other things? And if they do, does it even come close to giving them having the benefits of a secure parent?
Right. Again, a great question, because it brings also about the question of whether we are doomed if we don't develop secure attachment to our parents. So we'll get to that in a second. But to your question, it depends. Definitely, children develop attachment relationships with caregivers that are not their biological parents. And that include later on in life teachers, mentors. It can also include grandparents and older siblings. Really, we're thinking about human beings who children and later on older children, adolescents, and adults feel like they can go to at times of need, and as a result, they would feel a little bit better. They would be soothed and go back to whatever they did before the onset of the distress. It's interesting that you're bringing something like sports activity, because one would say, or one could think, that sports activity decreases anxiety, and it definitely is the case. But to what degree one could roam the earth feeling that no matter what's coming my way, I can rely on the football field to help me? I'm not quite sure. It's something that should be tested. My tendency is to think that we do need a human figure to rely on, even if it's not a parent, in order to feel or to existentially that we're not alone in this world, and that someone could help us to deal with whatever difficulty we're about to encounter.
Mm-hmm. Now, generally speaking, attachment has been looked at in terms of categorical styles. Most people that have heard of attachment will know that they're attachment styles. And as I understand them, right, you've already mentioned secure, and then there's sort of this other category where the child didn't get what they needed. The parent was sort of distant. And then there's a separate category where the parent was overbearing and didn't allow for enough independence and exploration, and they become over-reliant. Is it best to think of attachment styles as these three categories, or is it a little bit more nuanced than that?
It's definitely more nuanced than that, but I do think that the question is in place because we want to kind of think about, I want to talk with you about attachment in a way that can be more applicable to everyday life compared to what we do with this in research. The way I like to think about attachment, or the way I talk about attachment that feels like resonating with a lot, is a way of thinking about it on a continuum. Where on one side, I would call it attachment hyperactivation. That means that at times of need, we not only seek support, we do that excessively. If you think about adolescents or adults, those are those where when something bad happens, they would text nonstop to everyone who would just listen. And even if they don't, they would keep doing that. Why? Because their attachment system keeps alarming them something bad is happening. You need to secure as many people as you can and as much support as you can in order to overcome this. On the other side of the continuum, we have those who tend to have deactivating behaviors at times of need. In other words, when something difficult is happening to them, especially emotionally, they would deactivate behaviors that signal support. In other words, they would actually maybe resort to going to their room, or all of a sudden become silent and not talk to anyone for days. They would certainly not tell anyone who's close to them that they are in need, probably because they developed an expectation that it's not going to help them all that much. And in some individuals, it's actually going to be even worse if I tell you what's on my mind. Because I learned that maybe mom or dad dismissed it and made me feel like even more alone than not telling them at all. So again, to your question, I think of it as a continuum where on one side there is an excessive support seeking, on another side is an excessive directing of attention away from people at times of need. And the securely attached individuals are somewhere in the middle, and they're more flexible at times of need. They can, depending on the context or the figures around them, can be a little bit more demanding for attention, or can be a little bit more resulting into their own space, but they are not excessive in any direction. I hope this kind of organizes our thoughts about attachment throughout the lifespan, really.
Yeah. Now I think it does. My next question has to do with emotional modeling. So this process of building secure attachment on the part of the parents, is it the case that they need to model emotional stability for their children in the sense of, demonstrating proper coping mechanisms and not, flying off the handle, or is it more that, focused on the child? So how the parents behave is completely separate from how they treat the child when the child is distressed.
Right. So children really learn about behaviors in the world and what causes what in terms of their experiences, either by, as you suggested, modeling, learning by looking at what my parent does at times of stress. Attachment is more about learning by experience. In other words, how does my parent respond to me when I'm under distress? Now, if the parents who I go to at times of need show extreme distress when I'm distressed, I'm starting to developing maybe an understanding and an expectation that maybe that parent is not necessarily the person I want to go to at times of need, because they themselves cannot contain my difficulty. They cannot contain my anxiety, and they would not make me feel better, which is the ultimate goal of the attachment system. So I don't know that it's necessarily has to do with modeling calmness, but really about attending to the child. Now, if I'm attending to the child, but doing it excessively with a lot of anxiety, if the child screams, I attend the child, but I scream with them. That's also not a recipe for a secure attachment. Again, because the child starts developing an expectation that I don't trust that caregiver to help me at times of need. So I don't know that there's one recipe to teach parents. We need to talk about this as well in detail, but it's really about having an experience or allowing children to experience soothing rather than to model them how I feel as a parent at times of distress.
Yeah, let's dive right into this sort of for a little bit, this one-on-one setting between parent and child, because it seems interesting to me that the experiences I've had dealing with children, I've been in relationships with women that have had young children, and it feels an awful lot like you're walking a tightrope, in the sense that you want to validate whatever they are feeling, but validation doesn't mean give them everything they need in that exact moment. And I'm not really sure, like you said, what this mix is, but could you talk a little bit about maybe common missteps and how parents in these one-on-one situations can model the ideal sort of behavior?
Yeah, I actually stumble across this question explicitly when I sit with my clients, and they sometimes raise the question, theoretical question, when we start working together, and they want to know, how am I going to help them really? And right from the get-go, I tell them that, and this pertains to parent and child relationship as well, I probably might not necessarily know all that well in advance how to solve all the problems that they might come up with. But I think the main work is to allow them, if we can do that, to feel like no matter what is the problem, I'm going to be by their side to support them dealing with it. Now, that does not mean that sometimes an advice might not come up, and I would share this with them. And that does not mean that a parent cannot come with a concrete advice to a child. What you mentioned before about validating, I would call it, I would take a step further and call it acknowledgement. Like, I see you, child, or I see you, patient. You're not alone in this experience, because, yes, I validate what you're feeling is only one step. Another is to consistently allow them to feel that you keep being there until they feel better. I remember that in my own childhood, I sometimes struggled with this type of relationship with my dad, who's a very smart person, and would give me all kinds of advices that made me feel better. But it was not lasting for long. He would give me a very good advice and would leave me with it to do something with it. And so I'm going back to your question again about the validation. It's only part of the deal. If a parent wants to allow their children to really feel better for a prolonged period of time, it's responding to them, but also giving them a feeling that I'm consistently here for you.
Mm-hmm. Interesting. Now, can we tease out impacts from genetics? I'm curious as to how you even go about measuring attachment, and I know that you've linked attachment to some of these interesting mental health outcomes. Of course, it's always difficult, right? The child grows up in the home with the parent, but also shares half the DNA with the parent, and you could argue that the parent's attachment style, or how they address the child, is related to the child's temperament, right? Kids have, young children have a sort of, personality. I'm sure you could define it better. But how do we look at, how do we separate the effects of attachment from sort of genetic predispositions and temperament and things like that?
Yes, this is actually an ongoing debate in the field of attachment research, as well as temperament. And let's just make sure that we define temperament. Really, it's a behavioral manifestation of our genetic load. So this is why sometimes we refer to difficult babies or easy to warm up babies or difficult to warm up babies as something that is associated with the genetics. It's kind of like right out of the box, you can see how babies behave. And we're trying to tease, of course, apart whether this influences how we attach to our parents, because one would say really that if I'm a difficult baby and I cry all the time, I absolutely have no way of attaching securely to my mom because she's simply going to be very mad at me all the time. So is that maybe what causes insecure attachment, right? It's me, it's my genetics. It's not necessarily how my mom reacts to my needs. There are ways to assess it. One way is to look at twin studies. I think it's a little bit a more complicated way of explaining it, but I can definitely share with you that earlier on, we could see that there is no association between genetics and the way twins are attached to their parents. Another way to look at this is to, and this is what we did recently, is to say something like this. Those of us who have difficult temperaments probably will have two insecure attachments. And those of us who don't have difficult temperament would probably have two secure attachments with moms and dads. This is the logical hypothesis. If we're difficult babies, we're probably going to have difficult relationship with our parents. Now, what did we find in a sample of 700 something children? We found that there is an association, but it is very, very, very small. Something about we can explain variability in attachment patterns in children with genetics by 1%. Something again like 1% of why they behave the way they do with their parents can be explained by their genetics. So it's not much. There is an association, but it's very weak.
Interesting. Yeah. Now, a lot of the interesting parts of attachment research relate to how childhood attachment to different parental figures relates to intimate relationships. And right, this general idea that the attachment style that develops just sort of bleeds over and influences both how individuals choose mates and behave in relationships. I'm curious as to just how well the data fit sort of these stereotypes, because a lot of people can very easily visualize some of these stereotypes with attachment when it comes to intimate relationships, right? So, one of them is, for example, a woman with daddy issue, quote unquote, daddy issues, right? The idea that they seek out male partners that are not good for them, that are very similar to their parents. So if dad was not around, they tend to develop intimate relationships with men that are also absent because that's what is familiar to them. Or, for example, their father or parent was dependent on them as children. So then when they enter into intimate relationships, they want someone that relies on them, someone that they can take care of. These stereotypes have been around for quite some time, and you can kind of have knowledge of them without knowing anything about attachment research. How well does the research fit these characterizations?
Yeah, I cannot tell you that the research actually knows much about, or maybe I don't know much about the research that knows about these stereotypes. I can tell you that what you're describing fits very well with what Freud taught us early on in life, and he talked about something that is called repetition compulsion. We are finding ourselves in similar relationships, although they might hurt us, because we have this tendency to resolve something that we're not able to resolve growing up. So if we have, to use your example, daddy issues, we'll look for those same daddy-like characteristics in our partner, not because we like to suffer, but because we want to correct them with another figure. In my experience, a lot of the times it's actually the opposite. If we have daddy issues, or in other words, in my understanding of the stereotypes, if we have a dad that was not there for us at times of need, was absent, we actually develop quite a need to have what our dad did not give us. We're actually looking for this attention that was never sought, never given to us by our dad. So we actually look for the opposite. Now, I also want to mention that research does not support that there is difference of attachment patterns in terms of, for example, distribution of secure or insecure attachment between attachment to male figures or attachment to female figures. So I don't know necessarily that girls that grew up without a father would look for a specific male figure that resembles that absent father. I do tend to think that attachment is not associated with those kind of stereotype, simply because it's very relationship specific. If we grow up with a specific expectation that a parent would not be there for us at times of need, it might be generalized to how we perceive others. I don't know how it will play out in terms of actually choosing partners.
Mm-hmm. Well, so then, based on what we do know about attachment styles, could you talk a little bit of whether it's intimate relationships or mate selection? What are some of the adult outcomes that we know are linked to your attachment style at a young age?
Just before I answer this question, I want to also mention something with respect to your previous question. Research does show that those who are securely attached, as classified by a specific tool, it's called the adult attachment interview, tend to actually end up having a partner who is also securely attached. We don't know why, but there is an association between whether or not you're secure and whether your partner is secure. So there is actually some research about that. Now, your question right now is about whether early childhood experiences actually early childhood attachment patterns predict all kinds of adult outcomes. This is a problematic area of research, which we don't know much about because we don't have much longitudinal research. From what we do know is actually quite surprising. It does have a relationship with later on outcomes, but most of all, the one outcome that stands alone above others is academic outcome, which you would not necessarily predict. And there are multiple hypotheses as to why. If you look at adults predicting adulthood outcomes or children predicting childhood outcomes, you would see way more significant results with respect to emotional outcomes, social competence, as well as academic competence. But from childhood to adulthood, academic competence is really the one outcome that stands above all as significant.
Interesting. As I did a small amount of research into attachment, I started thinking about things like goal pursuit as sort of a very broad area. Being willing to take risks and pursue challenges as an adult. It seems as though you could predict that based on some sort of childhood attachment, in the sense of, how do you become successful at pursuing challenges? Well, if when you were younger, independence did not create too much distress. Independence was something that was fostered. You were given the opportunity to explore, whereas some children, when they explored, they like you said, their cortisol spiked, and they eventually just developed an aversion to feeling that way, or they didn't have proper coping mechanisms. There's kind of a story there where if you don't have a secure attachment to a parent, it could potentially fracture your ability to approach challenges in a very broad way. But you're saying that we don't really know for sure if that's the case?
Especially in longitudinal studies where, human beings are so complex. So many things happen in life, and so many figures come in and out of our lives. So many interplays between genetics and the environment are going on. It's really hard to predict anything. The fact that something is associated with early childhood experience is quite outstanding in and of itself. I think one thing that we can say is that if your caregiving environment is stable, then you might think, okay, well, I was securely attached earlier on. It's highly likely that I will keep being securely attached because this much we do know. And if I keep being securely attached because my caregiving environment is stable across maybe the 15 or first 18 years of my life, then we can definitely know what the vulnerability or lack thereof will be for you as an adult. The problem begins where the caregiving environment is inconsistent. Then people switch from secure to insecure, from insecure to secure. So what we measure at 1-year-old might not be relevant for the attachment pattern or status at age 3 or age 5. And that's why sometimes it's very hard to predict outcomes in adulthood.
I see. So why don't we wrap up talking a little bit about, what do you do if you, in terms of a clinician, how do you address issues related to attachment style? And I'm not sure what age would be, this question would be appropriate for, but I know that you incorporate your knowledge of attachment into a sort of clinical or therapeutic setting. Why don't you talk a little bit about how therapy or other types of treatments are designed to improve on, issues that come up due to attachment?
I think one major thing that Bowlby talked about in attachment theory is highlighting is the presence or absence of a secure base, which brings us to the beginning of our conversation today. A lot of the clients that do end up coming into therapy are those who never had a consistent, at least, if at all, secure base in their lives. In this regard, I think it's my job to try to develop a relationship that resembles as much as possible to a secure attachment between the client and myself. Now, how do we do that? That's another question. I think that there is something to be said about developing or adjusting one's expectations of who's going to be by me at times of need. If I come to therapy and I don't trust anyone, how do I trust you, therapist, that you will be there at times of need? Unlike a lot of my mentors and training experiences, I actually started working with clients under this model where I do allow them and I ask them to reach out in times of need. That does not mean that I will always be available between sessions, but this definitely means that I want to hear from them and I will get back to them as soon as I can and do everything I can to help if they feel like it's necessary in between sessions. With time, and the time is a question in terms of how long does it take, and it varies, but with time, my hope and my work is that their kind of attachment scripts, the kind of narrative they carry with them about what happened in this scary, sometimes sad, anxiety-provoking world when I need help, who's going to be there for me? If they can develop an expectation that I, the therapist, will be there for them, then they can also know how it feels to have someone by your side and then seek that type of relationship above and beyond the relationship they would develop with me or any therapist for that matter in their own lives. And this is the attachment work really across the lifespan, but especially adolescence and above, developing a new or adjusted set of expectations where I can trust someone, but I also can feel how it is to trust someone at times of need, and then go and try to have more of those experiences with more figures in my own life.
Yeah. Dr. Drew Pinsky always puts it in a way that he basically says that brains need other brains to grow. And I always go back to that when it comes to hosts of different mental health things that pop up that we try to address on our own. And so often it always turns back towards some sort of relational piece of psychology, right?
Absolutely.
We're out of time. Thank you so much for being on today. It was a very interesting topic that I was really excited to have a chance to speak to you about. Dr. Dagan, thank you so much.
Thank you for having me, Ryan.
For more on Or, visit ordagan.com. That's ORDAGAN.com. Or follow him on Twitter at Dagan_Or. You may also want to go back and check out episode 24 of this podcast on parenting, featuring Dr. Camilo Ortiz, who coincidentally is a colleague of Or's at Long Island University. If you enjoy this podcast, please share an episode with 2 of your friends. Follow the Why Do We Do That Facebook page for updates and additional content. Don't forget to rate and write a review on Apple Podcasts. Follow on Instagram at Why Do We Do That Podcast or Twitter at WDWDTpod. As always, feel free to email me with comments or guest suggestions at whydowedothatpodcast@gmail.com. Until next time, this is Dr. Ryan Moyer, hoping you found some answers to the question, why do we do that?